California.
Okay, I understand. You're on, sir.
Hey, thanks for having me here today, Todd, Chad, Sean. My name is Blaine Howson, and I'm the primary care rep for Northern California, and some of my responsibilities are to truly work with the physician assistants, the nurses, and of course the doctors. What I want people to see when I give a presentation is credibility, excitement, and enthusiasm. And these are the things that I want them to see.
Mm-hmm. And what do you find exciting about your job?
What I find exciting about my job is the ability to work with the doctors in terms of managed care and working with the nurses and showing the physician assistants how they can augment their practices to get the patients on Xenical and truly show success.
And you are on.
Well, I'd like to thank all of you for coming today. And Leslie, I'd just like to picture, if you will, a patient, maybe overweight, type 2 diabetic. Well, perhaps you don't even know that it's a type 2 diabetic patient yet. But what are some of the factors you're concerned about when that obese patient comes in?
Well, definitely, Blaine, the fact that they're obese. That's definitely an issue. And, I'd probably want to get some tests run on that patient to see,
run some labs.
what we can do about that. Because there's also risk of other comorbidities associated with his obesity.
Okay. Well, what I'd like to point out in vital signs of type 2 diabetics, there are 3 different areas to look at when that patient comes in.
Good, nice
Number
gesture.
1 would be the hemoglobin A1C.
Point to where we should look.
2 would be the impaired glucose tolerance test.
Mm-hmm.
And number 3 would be the fasting plasma glucose.
Good, nice.
And when we look at these vital signs, what we're looking at actually is what is normal, what the goal is,
Mm-hmm.
and then where there could lie a problem.
Could you do that one more time? Get really specific. Point to each one. While you're pointing,
What would be
take the
considered
time.
normal, what the goal is,
That's better.
and then what could be the problem with the patient. Are they presenting signs of type 2 diabetes?
Better.
And looking at the hemoglobin A1C, you'll notice that normal is less than 6%.
Show us with your other hand, Blaine.
The goal would be less than 7%. And then additional action would be greater than 8%. Looking at the oral glucose tolerance,
I'm just going to pause you. So what? Is there a takeaway on that? Or no? Is there? What does that mean for me?
well, what this means for you is that there is a definite marker where you may need to take action
Okay.
with the HbA1c if it's greater than 8%.
Good. Thank you.
And once again, looking at oral glucose tolerance testing,
Mm-hmm.
in terms of normal being less than 140, impaired being greater than or equal to 140, and then you know that the person is diabetic if it's greater than 200.
Good.
What that means is it's just a way to obviously test with the drink on fasting plasma.
Blaine, you can get better HbA1c, glycemic control if we lower the HbA1c level significantly.
Correct. In fact, for every point that you reduce, and this is according to a UK PDS study, each point would represent a 30% reduction in microvascular disease states. Is that,
Yeah, that's what I was looking for.
is that, okay.
Nice inflection. Good for you. Clear the last one.
Now, we have also
Just
fasting
pause,
plasma.
Blaine. I want you to really work on the eyes here. A little talking to the screen, yes?
Okay. And looking at this
Try
last
that
chart,
again.
looking at fasting plasma glucose levels,
There you go.
normal being 110,
Show us with your right hand for the videotape. Normal's 110, and then show us the difference with the other two.
okay. Normal being 110,
Mm-hmm.
impaired being 110, or excuse me, normal being less than 110, impaired being 110, and diabetic, presenting diabetes would be greater than 126.
Okay.
So when we augment this with Xenical, what we're looking at is being able to achieve a lower fasting plasma glucose level within 2 weeks. Hi, Dr. Leslie, how are you?
Hi, I'm doing well,
I
thanks.
saw you walking around here earlier, and I'm glad you
Yeah.
stopped by the table here. Notice you were glancing here at the Xenical brochure here.
But yeah, actually, I had a patient this morning that came in and I thought possibly could be a Xenical patient. And I haven't seen this before, so.
So have you
How-
used Xenical in the past
how can I
before?
know? I didn't use it too much in the past, but I've started to use it a little bit more and more in certain patients.
So what kind of relationship are you seeing with obesity and type 2 diabetes?
Oh, it's been on the rise, absolutely. I think it's harder now with managed care to spend as much time with patients, but I think what I'm finding is by just kind of asking some key questions that I am uncovering more and more that this is just a tremendous issue with diabetes.
Dr. Leslie, since I've got you here, I want you to meet Dr. Sean.
Hey, Dr. Leslie, how you doing?
Good to meet you.
Nice.
Dr. Leslie was just telling me that some of her concerns with type 2 diabetes and obesity, that it's obviously on the rise. Do you agree with that?
Oh, hands down, we're
Nice.
definitely becoming a fat nation. Definitely.
So how does that translate into your practice in terms of treating obesity? What do you?
I'm the Zenecal poster person. I firmly believe that blockage of dietary fat can reduce the glucose intolerance, plus maybe bring those patients from diabetes back to normal.
Yeah, and Dr. Sean, how are you starting patients on that? What are you doing?
Well, when they come in, I give them the option if they want to try diet and exercise first. Most of them, if faced with taking medications or trying to do it on their own, they want to try to do it on their own. I give them 60 days. If I don't see any benefit, then I'll actually start them on Zenecal before I start them on an anti-diabetic.
Some great points you make, so. I'd like to also point out, because you were grabbing the aid here, if you look at even the fasting plasma glucose, and Dr. Sean, perhaps you can hold this for her. The fasting plasma glucose, in as little as 2 weeks, this chart shows the fasting plasma glucose against time, and then as little as 2 weeks, we're showing significant drops and maintenance over time. And also, to augment that, if we look at hemoglobin A1C, which I agree is or you would agree is very important in terms of lowering it, based on our clinical trials here, looking at the A1C being high here and its drop on Zenecal, you'll also note that those with a higher A1C were actually able to achieve a greater reduction.
Let's see that again
While-
with your gesture hand. Give me.
We're able to
other
achieve a
hand.
greater reduction
Take your hand out of your
on
pocket.
while on
There.
Zenecal. So, Zenecal is dosed at 120 milligrams TID, and the only contraindication is cholestasis and chronic malabsorption. And knowing this, with the safety factor and the things that we pointed out, and the fact that Dr. Sean, obviously, he endorses it, would you be inclined to perhaps write a few scripts and get a few patients on Zenecal?
Yeah, absolutely.
You are on.
Hi, Dr. Byler. Good to see you again.
Good to see you again, Blaine.
Yeah, I know you're really busy.
I am.
The last time I was in here, I had asked you if you were using Zenecal for type 2 diabetics, and your comment was, no, I don't use it for type 2 diabetes, I use it strictly for weight loss. My question is, have you seen any data showing benefits towards the type 2 diabetic with Zenecal?
I've seen some, but not a lot. I know that it's not indicated for type 2 diabetes. I haven't really paid a lot of attention to it in the past.
Okay, my question for you is, if a person's going to lose weight, what are the internal benefits then?
Well, lots of benefits. I mean, this metabolic syndrome is less likely to occur, osteoarthritis, gout, foot, a variety of things.
And internally, to augment that, what I wanted to do is show you some data showing the internal effects. And this is correlated with type 2 diabetes.
Here, the doctor for
I haven't heard that in a while.
All righty, you're on, gentlemen.
Hi, Dr. Shad, thanks for seeing me today.
Oh, it's nice to see you, Blaine.
I drove quite a few hours to get here, and I've been thinking about, things that I wanted to share with you, but I feel that it's more important that you share with me your thoughts on type 2 diabetes and obesity, so that therefore I can provide maybe some more information for you.
Blaine, my patient load is 70–80% type 2 diabetics. And as I think you are aware, the two are kind of correlated when obesity is spoken of in the same sense. You want to see type 2 diabetes with obesity about every patient that fits the bill.
So what you're saying is this tends to be the norm when you see that obese patient?
Yeah, definitely. I mean, you see a patient come through the door,
type 2 diabetes. They're the pre-diabetic or leading up to type 2 diabetes, have type 2 diabetes, they're obese, they're hypertension.
Obese, hypertension. It sounds like these are issues that are very important to you to address.
Well, when my patient load, the percent-wise is that big, you're kind of forced to give it a lot of attention and pay a lot of attention to it, take care of the patient.
In terms of taking care, tell me more about that.
What we've been trying to do here, I use the Atkinson diet a lot to try to help the patient lose the weight, keep the weight off, anything. As far as the diabetes is concerned, I'll mix the Atkinson diet for the obesity, and as far as taking care of their diabetes, I'll put them on anti-diabetes, metformin, sulfurate, something like that.
The Atkins diet, how is this affecting your patient?
As far as affecting the patient, not everyone's going to succeed. I have some successful patients, some are not. Hopefully it'll benefit them in a positive way, but of course, not all of them are going to be successful.
I guess more on a personal level, on a scale from 1 to 10, how do you feel this regimen is working?
I would probably give it around a 4, 3 or 4.
Why do you think that is?
I just don't think the Atkinson diet alone is going to give the patients the results that I'm looking for. They're wanting a magic bullet, they want to wake up thin in a week. I'm looking for 5 to 10% to be clinically significant.
So what you're saying is if you could achieve 5 to 10% in weight loss, then that would motivate you.
5 to 10% means the world to me. Because I know how it's going to improve their health naturally by just losing the weight.
Which also translates to better outcomes, especially for your own practice.
Oh, of course.
So how does that affect your practice ultimately?
Good job.
I think if I could have more successfulness dealing with my type 2 diabetes and my obesity, I would probably have more patients coming in just by word of mouth. How everybody that's overweight has a desire to lose weight, or most do. It's just a matter of being committed enough to take the steps or have the willpower to succeed with it.
So once again, just a quick overview. A lot of your patients are obese, type 2 diabetics. They do have some constraints in terms of conforming with different diets. You've tried the Atkins diets. What I would like to do is actually present to you a regimen with Xenical and provide even more information for you in terms of looking at comorbidities, HbA1c, looking at fasting plasma glucose. And if I share these with you and you see that this is significant, would you be inclined to try using Xenical on more patients?
If we could see, like we talked about, 5 to 10% and add all these benefits as improving their comorbid conditions, I'd love to give it a try.
Okay. Well, what I'd like to do is share with you this information, and going back here to this chart here, if you look at the fasting plasma glucose, in as little as 2 weeks we show significant drops. And to augment that on this chart here, located on the lower right here, you can look at the HbA1c. For those that had the higher A1c, they were actually able to achieve greater significant loss. You find that compelling, Doctor?
I see that. That's very impressive.
Well, can I count on you to use Xenical in the future for your type 2 diabetic patients?
Be glad to. Thanks for your information.
Thanks for your time.
All right, give him a round of applause. Efficient. Efficient. Even though your intention was to probe in the beginning, honestly, that was efficient. You still had time left on the clock, and you got to where you needed to go. What did he do really well?
Constant
Recap.
recap. That's
Yeah, a playback. He really played.